Hello, and welcome back to our continuation of the EKG bootcamp. Tonight we'll be covering first, second, and third degree heart blocks.
Ninja Paramedic Guy, Ninja Paramedic Guy, Ninja Paramedic Guy. Medics rule. Ninja Paramedic Guy.
Accidents are the cause of trauma.
Ninja Paramedic Guy. Ninja
Rescue 804, arriving on scene.
Ninja Paramedic Guy.
Let's start off by looking at the first and third degree heart blocks. The first degree is honestly the hardest to spot because it looks so similar to the normal sinus. The only thing that gives it away from not being a normal sinus rhythm is the fact that the P waves have longer PR intervals than they should. This means that the PR interval is going to be greater than 5 of these little boxes, or 0.2 seconds. The rate on a first degree heart block is usually going to be sustainable for life and will not have any negative impact on a patient. The more noticeable of all these heart blocks is going to be the third degree. This is the most severe heart block that you can be in because there is absolutely no correlation between the P waves and the QRS complexes. With this heart block, you're going to have P waves just chugging along at their own rate, usually whatever the pacemaker of the SA node would want to be, and the QRS going at whatever rate it would have had set by the AV node. You'll notice that some of these P waves will be either immediately after T waves, buried in the middle of a QRS complex, or occurring completely independent of everything else. Now, moving on to the second degree heart blocks, it is important to note that there's 2 types of second degree heart blocks. A type 1, also known as a Wenckebach, or a type 2. Now, both of these I saved for last because they both involve missing P waves. However, one of these has a pattern, the other does not. And the way I remember these two being separate from each other is to think of Star Wars. The first is ordered. In other words, it follows a pattern. So for a Wenckebach, or a second degree type 1, it's ordered. And it follows the pattern of short, long, drop. Alternatively, short, long, longer drop. And it's a pattern that will repeat over and over when you can predict what the next missed beat will be. As for the second degree type 2, the P waves just randomly drop out whenever they want. So you'll have a QRS complex after your first P wave here, no QRS complex here, you'll have a QRS complex here, another one with a hit QRS complex, and then another random drop beat, QRS complex, so on and so forth, just randomly dropping QRS complexes out of the rhythm of the heart. Another important thing to note when looking at second degree heart blocks is that the type 2 is worse than the type 1 because the type 2 can rapidly convert into a third degree heart block. To review, there are 4 total heart blocks that you can have in the AV node. You have the first degree, which just has longer PR intervals. The third degree, where there is no correlation between the P waves and the QRSs. A Wenckebach, or second degree type 1, which follows a pattern or order of short, long, longer drop, or short, long, longer drop. And a second degree type 2, where it just randomly decides not to have a QRS complex with the P waves. Well, that's all the time we have for today. If you liked the video, please like, comment, share, and subscribe. And as always, until next time, see ya.